Today, in our 5-minute tip, we are going to talk about dental adhesives. In clinical dentistry, we have many options when it comes to selecting a dental adhesive. In this dental tip, we are going to focus on universal adhesives because they are frequently used all around the world in dental practices. One thing we must understand is that regardless the type of dental adhesive you select, they all need to condition, prime, and bond to the substrate. One question that we must ask ourselves is how effective are universal adhesives when used in combination with chemically or dual cure resin restorative materials or cements? The easy answer is that it depends on their pH. If their pH is less than 3, they are considered to have a strong acid within them. On the other hand, if the pH is greater than 3, they are considered a weak acid. In summary, universal adhesive with a pH greater than 3 will not affect the dual curing properties of restorative materials or cements. Gary Alex published in 2015 a paper on the basic chemistry of universal adhesives. In this paper, you will find a chart with a list of dental adhesives and their corresponding pH. So the question now is, what to do when your universal adhesive has a pH lower than 3? We are going to use as an example the 1-Coat7 universal adhesive from Colteen. It is important to understand that if you were to use this adhesive in combination with a dual cure resin cement like Duocem, you would need to add the 1-Coat activator to your protocol. What the activator does is that it will increase the pH of the adhesive layer, allowing proper dual curing polymerization of the resin cement. Let me walk you through the technique using a clinical example. After preparations, final impressions, and temporization of this case, we sent a prescription to the lab for a full contour zirconia fixed dental prosthesis. Once received and proper fit confirmed, we are ready to follow the ACP concept described by Blatz. In step 1, we microabrade using 30 to 60 micron aluminum oxide particles for 20 seconds with low pressure. This step should be followed by ultrasonic cleaning for 5 minutes. In step 2, we apply a ceramic primer like Monobond Plus to the intaglio surface of the abutments. In step 3, we will start the bonding process. When using a universal adhesive, you can either selectively etch, total etch, or use the self-etching properties of the universal adhesive like we did in this case. You will dispense 1 drop of 1-Coat7 universal adhesive and, in a rubbing motion, you will apply it to the abutment teeth for 10 to 15 seconds. For the second coat, you need to mix 1 drop of each, the universal adhesive and the activator, and then apply following the same instructions as before. At this point, you want to eliminate any excess using a dry microbrush, and then with forced air gently eliminate the solvent and light cure. Our final step will be to dispense the dual cure resin cement into the intaglio surface of the abutments and seat the fixed dental prosthesis in place. Here is an image with the prosthesis immediately after delivery and from a lateral view 30 days after delivery. Thank you so much for your time, and please don't forget to follow Romero Dental Seminars in all these social media platforms.